there is an exhibition going on titled Taking Care. Taking care of whom? By whom? That we will know. And I'm really overwhelmed, and I think it's just fate and providence which has brought me here to be in conversation with Virginia, who has served tuberculosis patients at the Seaview Hospital. I won't say anything more, just that Virginia is today 93 years old, walks straight, and can put many of us younger people to shame. And despite having led a life which was full of turbulence, hope, despair, all at the same time. So I'm handing over the mic to Virginia to please share her story, which will give all of us hope, and also the tuberculosis patients who are suffering in so many parts of the world. It will give them hope and give the medical fraternity also a lot of food for thought. Virginia, can you please share your life at Seaview Hospital and even before that?
Greetings. My name is Virginia Allen. I reside on Staten Island in the nurses' residence where I once worked and lived. In 1947, at the age of 16, I came to Staten Island to go to nursing school. I had just graduated high school, and I was thrilled with my aunt's uniform and her cap, and it was, she inspired me. And luckily, I got a job as a nurse's aide while I was waiting to go into nursing school. And it was a beautiful experience. I had never worked before, but being with the children in the children's pavilion at Seaview Hospital and Home was a very nice, warm, comfortable experience, because the children there were like any other child at home. So you had to help them with their baths, make sure that they got ready for school, and when they came home from school, which was right in the building, I helped them with their homework and talked to them. We were family for the children because they were away from their parents. A lot of their parents were in the adult pavilion, but we had to treat them as if they were home because they were children. Unfortunately, some of them were very frail, but most of the children were very robust. The disease had not reached them as it had the adult patients on adult pavilions, who were very frail. Some of them could not walk. They had to have even more bed rest. At that time, the cure for tuberculosis was, in 1947, fresh air, lots of rest, and a very rich diet. And then came along Dr. Robichev and his team, and they founded the drug that will take cure isoniazid, which was tested on the adult patients, not the children. The children received streptomycin, but not the other drug. I think it would have been too strong for them. This is many years ago. So I'm thinking as I'm talking to you and recalling It was like a miracle in 1951 when the drug was founded. It seemed like a miracle cure. The patients were responding well, and thank God, the nurses who work with the patients, who we call the Black Angels, did a very good job of documenting the effects of the drug, how the patients responded to the drug. And during those trials, the patients were able to go home and take the medication at home. So that was a very big and important part of recovery. But that doesn't mean that tuberculosis is not still a very dangerous dangerous disease. It's still very prevalent in many countries where the drugs are not available and not made available to the people who need them. And that I'm going to give off the mic to
My name is Shobha.
Shobha.
Virginia, I want to know, you were born in USA, in New York?
Not in New York, Pittsburgh, Pennsylvania.
Okay, in Pennsylvania.
Yes.
And was there must have been a lot of racial discrimination at that time?
Yes, there was. We had a lot of discrimination. There were only 4 hospitals that treated Black patients here in New York out of 29 city hospitals.
And in the southern states it was more?
Even more racism. There were many places that nurses could not actually work as a nurse because there were no jobs open. They needed nurses. There was a nursing shortage, but they wouldn't hire Black nurses.
But they hired them in CU Hospital because
they couldn't find nurses here at CU because of the danger of the disease. And a few nurses did get tuberculosis, but luckily I did not. I followed my instructions and training using isolation technique, which is very important. And I'm sitting in front of you now, germ-free.
yes. So I was coming to that. What like before the isoniazid drug came into me and was given to the patients, they were given streptomycin or what?
Yes, streptomycin and other vitamins were used for the founding of the drug.
And some patients did get cured, was it?
Most patients were cured.
Most patients were cured. What were the infection prevention techniques you followed as a healthcare giver, and what were followed by the patients also? Because prevention is still, I feel prevention is always better than cure even in today's times, and we are failing on many of the prevention tools which we have ready.
That's true. It was rare that you would ask the patient to wear a mask. The nurses wore masks and gowns. Now they wear even more elaborate gear, like they cover their hair, their feet. Years ago, we didn't.
And there was TB in the children also that time. You were talking of caring. We have read also your fondness for the kids and children you worked with. But they were children of parents who were admitted in the hospital with TB, or
Some of them. And they probably found the tuberculosis germ in the children as they were testing them or giving them the vaccines, the vaccines that we usually give to.
The BCG vaccine was there. Okay. So, but all the children who were living there, they had TB or not? Some of them?
Oh, yes, they all had tuberculosis.
So, extra care for the children also, which you were doing and other nurses were. Um, can you recall, or of course you can recall, can you share just a day in the life of a black angel there at the hospital?
My day usually started in the morning about 6 o'clock. I always had breakfast before I left home. And I lived close to the hospital, like a mile and a half. So I was able to walk to work. My aunt walked to work. Most people who live on Beverly Avenue, which is a thoroughfare that's near the hospital, walk. And I would go in and take the report from the staff who was leaving, make my rounds. We were taught to make rounds to make sure every patient was okay. We make rounds with the staff that's leaving and find out any unusual occurrences with the patient. And then discuss their assignment, which could be as many as 10 patients or exactly 4. It's according to the workload. So there's the children every day. They had to have breakfast. Usually that was served from the night shift. And we got after we see and all they have lunch. And then homework, snacks. And if they were toddlers, of course, you have to take them to the bathroom. But that was usually my day. But it was a full day.
And the children who went to the school, that was in the campus of the hospital?
It was in the children's pavilion in the basement.
Okay. And who were the teachers there? They were black or?
Well, they were mixed, but it was a full staff of teachers. Because the children ranged from age 3 to like 17.
And those who were the younger children, were the parents with them or no? They were segregated?
We were there.
You were there.
The parents were not there. And some children did not have visitors because the parents were either in the hospital or they were too sick to come and visit. So we were filled in as parents with them.
But there were some visiting hours for the parents who could come.
Oh, yes, every day.
Every day. Okay. You must have seen patients passing away, and some nurses must have understood what tuberculosis when you were there. What were the feelings which came that will tomorrow be another day or not another day?
I was very carefree at that time. I was still in my teens and early 20s. So my attitude toward my job was a little different from some of the adult women. We did have nurses who were frail themselves. So they did get sick, but they were treated and they were able to come back to work. And I'm not sure about the death rate. I never heard of it.
And when did you I wouldn't say you retired, you will never retire from work, this is what I said. But when did you change the course of your life? When did you leave working at the hospital?
I left the hospital in 1957 to do private duty. I thought I would like to, I graduated from nursing school. Then I stayed at CU a year. In 1956, I graduated. And I felt that I wanted to see what else was happening in nursing. So I did private duty for about a year, maybe 18 months. And then I went to work at Brooklyn Jewish Hospital in the operating room as an operating room nurse, which I loved because it was a fast pace and you had to be on your toes all the time. So that was a challenge for me. I love challenges, still do. And while I was at Brooklyn Jewish, I was approached to come and work for a labor union, which I did, 1199. That's the union that represents the nurses, nurses' aides, the healthcare workers. It's part of the Service Employees International. How much time do we have? One little story.
Oh yes, I have all the time. My days for you.
Okay. The reason why I started working for the union, at that time, I didn't think nurses, it was professional for nurses to belong to the union. And when they tried to organize us at Brooklyn Jewish, I fought them tooth and nail, and I won. So the president of the union wanted to find out who is this person? Because I had no one helping me. And you know, when you're doing a campaign, it takes a lot of time. And I did spend time, and I was very convincing. And when they met me, they said they wanted me to come and work. They wanted me on their side. And after a while, I was convinced that the union is a good institution. They do so many good things for people. And all the benefits that we have working is because of unions. And thank God for it. It supports and protects our jobs.
So you worked with the union till when?
I worked with the union, and then I decided I needed to be home with my daughter, who was a teenager at the time. You know how it is with teenagers, you really can't leave them on their own.
Yes.
So working for the union, you're out late at night, early in the morning, walking picket lines, and I'm not the type of person that says I can't do certain things. So I thought it best to take a hiatus, which I did. And I must tell you, my daughter was a nurse also. After getting her degrees and moving to Altus, Oklahoma with her husband, who was a serviceman, she couldn't get a job. She was overqualified. And I told her to go back to school to take nursing, which she did, and she loved it. Just as and unfortunately, I lost her in 2002. A massive heart attack.
And that was, and she was working at that time?
Yes, in North Carolina by that time.
That's sad. That must have been a big setback for you.
Yes, I think of her every day.
And she had kids or?
2 children,
Okay.
2 sons.
Okay. So what are they doing now?
One is an artist, he lives in Brooklyn, and the other one is still in North Carolina, and he works with the school department of education there in Greensboro.
And now you've come back to Seaview a bit. You live there now after being to Brooklyn and elsewhere.
Yes, I live in the nurses' residence. The nurses' residence was renovated in 2008 for senior citizens. And the apartment that I live in now is like 7 dormitory rooms. Yes, it's beautiful. It's a 1-bedroom apartment, and it's very comfortable. Gabriella's been there.
Yeah, it's beautiful. It's beautiful.
Now,
Oh, I'm not done with this. But just, come on. 93 years of life, no matter how much you want to shorten it, you cannot. So now this house has been given to you by the government, or what is the system there? I do not know. For senior citizens.
I pay a big rent there.
You pay a rent.
Yes, it's a rental.
Oh.
It's not gratis.
Okay.
It's market rent.
Okay. So if I'm not intruding too much into your personal matters, what is your source of income?
I have a very small, to me it's small in comparison to the retirement that nurses have today. It's less than 2,000. And then if it wasn't for Social Security, I would be a pauper, which is also less than 2,000.
Now, the Seaview Hospital, I believe it was closed in between, it has reopened now, but you don't go to the hospital there at all.
Yes, it is. And you go to the hospital. It's in 4 pavilions were taken down to build the Robichek Center, which was a rehab center and a nursing home, skilled nursing home. And I think they had something like 200 beds, combination of rehab, I'm not sure. But I was there for a ribbon cutting of the murals that were painted for the auditorium area. As a matter of fact, I have a picture of it in my car. So if you wish to take a picture of it, of that ceremony, I was just there. Yes, that here, these murals predict, it tells a story. The beginning of Seaview. I think this is there.
Yes.
And I am here.
That's you in the front of the book, right?
And this is the doctors who founded the cure. And this is
Present day.
present day. This patient was still living when the murals were painted a couple of years ago by Yana, what's Yana's name?
Dimitrova.
Dimitrova. And in
Was she a TB patient or no?
no, this, the lady in the photo here was. she was still a resident of Seaview.
But she was there when it was in tuberculosis hospital
Yes.
too? Okay. Now you can take a picture of this too.
I was speaking to a group of clergy last week at the Rotary Center, and this I guess you would call it the poster was given to me. So I'll share it with you. It's in the back seat of my car.
You still drive?
Yes, I do.
Please say it loudly.
I'm still driving.
Yes, great. Virginia, I want to ask another question. Being a black and being a woman, was there some discrimination at the time? Because I still find a lot, I come from a third world country. I also come from a country which has the highest burden of tuberculosis. Women are still struggling to find a place in society, and there is a lot of gender inequity, at least in many parts of the world.
I have felt a lot of discrimination in my lifetime. I'll just give you one incident. It's like being in the room where you feel and you know that you're invisible to those other people. But you know who you are. I think that's been my salvation. I happen to be strong enough to know who I am and my own worth, which was taught to me by my parents. I think it was a mantra. So, I don't, I understand it, but it is still prevalent. And I'm hopeful, and I'm very happy to know that we have a black woman, and she happens to be half Indian.
Yes, in the presidential race.
In the presidential race now, and hopefully we can break through that glass ceiling. We're there, but we haven't broken through, and I'm just hoping and praying that people realize what a gem she is. She's a gift to us if we only take it, if we only embrace it.
And you're talking of the glass ceiling, and I agree with you, Virginia. We have to break the glass ceiling. And there will be a lot of glass pieces which will shatter. But we are there, and I think we are strong enough to take the onslaught of the shards of glass which comes down.
I think so too.
That is very true, and that gives a lot of hope to us. And because still there is a lot of, even say I'm reminded by the title of this exhibition, Taking Care. Caregiving work is taken to be a woman's prerogative. It is said, that sort of things that you say, yes, by birth, a woman is softer and caregiver, and it absolves all the men from all the caregiving work, even the household chores and everything. I will give the mic to you in a moment to talk about that, because there is so much of gender division of labor which I find now. Even nursing in a country like India now, most of the nurses are female, are women, because it was thought, no, men are good to be doctors, not nurses. I think in the Western world they have broken that ceiling, but still in the developing countries it is still very much there.
It hasn't changed much here. We have a few male nurses, but not as many as we should have. Thank goodness, more males are going into the field of nursing. Most of them in the administrative part, but at least we have like members.
Yes, so I'm glad you are talking of that because I don't think there is nothing genetically ingrained in women that they are caregivers or they have to bring up children, and men are the entitled people. In India, still, even amongst the very educated family, they long for a boy, not a girl to be born, but a boy to be born, because they feel that boy will solve it all their problems and difficulties, which is not so true, not true in the case and real life. So I hope it's so inspiring, Virginia, to speak to you. And how many years did you spend in the senior hospital?
10 years, but I'm back there now.
Yes.
And I've been in nursing over 50s.
So that's a great time, and so nice to see you. And you, as I said in the beginning, you don't look your age. I can tell the figures now, 39. That's that's what I can do. And thank you very much for talking to me for so long, and it has been a real pleasure for me. Like my trip from India to New York is made speaking to you. Anything else you would like to say, or give some message to the women of today?
Thank you. I'm going to ask Gabriella to introduce herself.
Okay. Oh, yes, Gabriella.
Okay. Hi, I'm Gabriella Leone. I am co-curator of Taking Care, the Black Angels of CV Hospital, with my colleague, Riley Genoso. And we've been so honored to work with Virginia Allen and all the people who were able to make this history possible and this exhibition possible. We're really thrilled to be amplifying this story. Virginia Allen and the descendants of Curly Jennings Bennett and Alan May Clark and the descendants of the Black Angels have been telling the story for a long time. But Staten Island Museum's excited to be amplifying this story and getting the word out about it, because it's incredible history and it happened here on Staten Island.
Gabriella, thank you for being here with us, and a little more about your life and what inspired you to curate this exhibition, and something more about your life first.
Sure. I'm born and raised on Staten Island, so I'm passionate about its history. It has a rich history, and I think has in some ways has been overlooked or overshadowed by some of the larger boroughs of New York City. But Staten Island has a very rich history, and when I started working at Staten Island Museum 10 years ago, and I learned soon after I came here this story of CV Hospital, and I met Virginia Allen. She was volunteering at the museum at the time, and did an oral history for one of our other exhibitions that's in the museum. And so I think the museum has known for a long time the import of this story. The book by Maria Spilios came out last year. Maria had been doing research in the archives she researched the book for, I think, 7 years, Virginia? Yes. And put so much time and effort into telling that story. And so the museum wanted to time this exhibition along with the release of that book. We were able to work with families to get artifacts, heirlooms from the nurses themselves to show in the gallery, which has been incredible. And I myself did some research in partnership with the College of Staten Island, where I'm an alumna, to do an online exhibition featuring the oral history of Virginia. So it's been a few years in the making, and we're thrilled to have it out in the public eye. And also there'll be a catalog coming out about it next month, which will immortalize even more all these stories we've been able to tell and share all the nurses' names that we know. And we're still looking for more nurses' names. We know there are people who work at CV whose names we don't know yet, but we want to get as many as we can.
Gabriella, something more about the CVU hospital. You come from Staten Island. Why was this place chosen to to have this hospital. What was the purpose, of course, was, as Virginia said, it was a sanatorium in the beginning. And then as we went through your exhibition, we found that there were people from different places, different countries and nationalities who came to that hospital. Do something about that.
Sure. So Staten Island was chosen as a place for Seaview because it was far from Manhattan city center, right, the most populous area of New York City. Staten Island had this reputation for being a place where there was fresh air, where there was a healthful environment. There were resort communities along the south shore of Staten Island, especially at the turn of the 20th century. And so Staten Island was an attractive place for the city of New York to build Seaview Hospital because it was far away and it had this healthful environment. But there's sort of another side to that coin, which is that by putting patients who were at Seaview, who were often poor, they were from immigrant communities, they lived in the tenements, densely packed neighborhoods in New York City, that the city could sort of put them here on Staten Island and forget about them, out of sight, out of mind. And so that's why Staten Island was an attractive place. And just, you were mentioning before, Seaview was open on Staten Island from 1913 to 1961. It closed as a tuberculosis hospital. As Maria Smilio says, the Black Angels put themselves out of a job. They did the, they worked on the clinical trials for isoniazid here in 1951, and then 10 years later, the hospital was no longer necessary as just a tuberculosis hospital because the nature of tuberculosis changed from a chronic inpatient illness to one that can be treated outpatient from home. So as Virginia mentioned on Seaview's campus, a nursing home is now open, as well as I mentioned to you, some adaptive reuse spaces. The Staten Island Ballet is there, the Grease Foundation, the fire department. Because it's a historic district, the historic character of the site remains the same, but the use is different.
How is it that there were patients who were coming from different countries, at least in that log register it showed us? People from Russia, from even Philippines, like Asia, and why was that?
Yes, at the turn of the 20th century, New York was, and still is, a mecca for immigrants from all over the world. And so some arrived sick with tuberculosis from their journey. Others contracted it in New York City, as I had mentioned. Many people were living in very close quarters with poor ventilation and other things that put them at risk for tuberculosis. But the hospital itself, the population of the hospital was reflective in some ways of the global nature of New York City. People in New York City were from all over the world, and therefore the patients were from all over the world.
Anything else, Gabriella, you would like to share, or anything else Virginia would like to share, which might have missed my listening? Also, Gabriella, what about something from you on the gender equality or inequality? I'm sure it must be much less in places like New York, but I do not know exactly what it is.
Well, I think in terms of the development of this exhibition, we certainly thought of taking care, as you mentioned, as historically women's work, right? Most of the nurses that we studied were women. I think there were a few men on the nurses' roles in the years that we looked at, but the vast majority were women. And, I think to your point before, this was largely invisible work. It was Edward Robichek and Irving Selikoff, the doctors who ran the study, who received the Lasker Award, which is a prestigious medical award for their study of isoniazid, but it wasn't the nurses who administered the trials along with them. And I think that a lot of that has to do with gender inequalities in the healthcare field, especially then, but I'm sure that exists today as well. So, in my work as a historian locally, I've sought to tell women's history in particular, the major exhibition that I curated before this is called Women of the Nation Arise, Staten Islanders in the Fight for Women's Right to Vote. And it was about the movement for women's voting rights here on Staten Island. And they received those in New York State in 1917. But even then, but also that exhibition was about how voting rights are fluid, right? They're not something you get and have, they're something you have to continue to fight for, because a few years later there were literacy tests that barred some people from the polls. And even today, right, concerns about how election districts are drawn, or how easy it is to get to the polls, creates social, racial inequalities still. So I think my work as a historian has been to sort of point out that these rights, this recognition, is something that you have to be vigilant about and continue to fight for.
And one more right which comes to my mind, because today is the 27th, tomorrow is the International Safe Abortion Day, and even abortion rights are not there in all the states, I think.
Yeah, it's still an issue. The Supreme Court overturned Roe v. Wade, which allowed federal protection for abortion rights, and so now it's returned to the states, and different states in the United States have different laws regarding that, and there's a conversation going on about how that jeopardizes women's health today.
Speaking of abortion rights, we're talking really about healthcare, not just an abortion. That covered all types of care for women, maternal as well as everyday health care.
Yes, and there is disparity.
Very much so. And it was devastating to all women, should be, to have their health care stripped from them like that. Only because some men felt that parts of it didn't agree with their ideology.
Yes. So now your parting message, Virginia.
I am honored to be here and to bring a message to you and your country. I'm sure this video will cover. Healthcare is precious. I feel that universal healthcare should be for everyone, not just a few. So if your country could, and I'm not sure, I don't know the policy, I know we're fighting for universal health care here in the United States. We should have said it many, many years ago. I think it's our right.
Thank you very much, Virginia, and thank you, Gabriella, for making this happen.
Thank you.
It has been a great day.
Thank you. And what is your